resources that get mentioned in the webinar that you can check out. All right, so I'm Holly Fletcher. I am the moderator of today. My day job is I work in news and communications at a large academic health system, and I've been working on sustainability as a through line through most of my career, which started as a journalist. Back in New York City quite a few years ago, covering the power and utilities sector. I've worked on sustainability in various forms, including at my current role at the AMC. And I'm currently near finished getting a master's degree in sustainability. So I'm getting a master's in science, which is looking at hydrology, water policy, a lot of green building, business metrics, earth sciences, um, to really put the official framework of technology and science around the work I've already been up to. And it's been a really fantastic look at how the sustainability sector compares and contrasts with medicine, academic medicine, and also my kind of home industry of journalism. There are some really key differences in the sustainability sector that I think people who work in healthcare and in the hospital settings could learn to incorporate in their collaborative efforts as they begin to take on these. So we are trickling in a good bit. I see all of the comments are very much kind of the area I was expecting. I do love to see that we've got an electric engineer. That's fabulous. We have a sustainability lead and value analysis manager. I am envious of your skills there. That's fantastic. Today we are hearing from 4 radiologists from around the country, and we are looking at essentially what walls they have hit, where they have found success, and how they've pivoted. We're also going to be talking some about how they are working with colleagues in Europe to bring over and collaborate on some frameworks and roadmaps that are already well in place in Europe that the US is quite late on. That is not a critique. That is not a critique, it's context. And within that, I think it's important to really think about the historical kind of leaning into proprietary data that is so common in academic medicine and healthcare. Everything is your magic potion, and that is what makes your biz go. But in sustainability, that's really not how companies work, how teams, even within large companies like Starbucks or Trane, it's a more collaborative kind of roadmap sharing where they do keep maybe the details of their vendor contracts to themselves, but they may make public a template of a vendor contract that people can learn and work from. Because the ethos in sustainability is we all win together and we all turn into a crisp together. So this whole notion of what's mine is very antithetical to how that industry worked. And based on pre-interviews with all of our guests today, that comes across as a theme that they would like to see change. And the only way that can get changed is if there's a wholesale kind of rethink on what do we talk about and how do we talk about, and what kind of handshake do we let lend and pull people into the work. So from that I'm going to let because of the some of the sensitivities around sustainability in the United States in this current era, The guests are free to say where they work if they will want to, but if not, just know that they are all practicing radiologists and they have a variety of leadership positions within their institutions and also on the national scale. So, Dr. Gerson, let's hear from you real quick on who you are, and the icebreaker question is, I'd like to hear a brick wall that you ran into in your sustainability efforts and how you pivoted around that. And we'll do that for each of the guests. Dr. Hijaz, you'll be next.
Great. Hi. Thank you for inviting me to be here. My name is Rachel Gerson. I'm a private practice radiologist in the Pacific Northwest. I also serve as the co-chair of the Sustainability Committee at the American College of Radiology. And I think some of the brick walls have been around a feeling that nothing we do can make a difference. I think I live in a part of the world where people are enthusiastic about sustainability and the environment, but also, particularly when it comes to healthcare, have this sense of like it's too big to change this system. And particularly, I think, in the private practice setting where often you have a relationship with a hospital, but you don't fully control decisions around capital expenditure, how you do things. Yeah, and you're also so overwhelmed by the volume of work that you have that people feel like this is just sort of beyond what they're able to think about, and they're not going to make a significant difference anywhere. So I think that that can be a real obstacle, and I think that's where we really have to start to change minds and say and share ideas about no, you can make a difference, and here even just a single step forward can move you along your sustainability journey.
You're up, Dr. Hedge. Dr.
Okay. Hi, everyone. Thanks for joining us. My name is Tarek Hijaz. I'm a neuroradiologist at a major academic medical center in the Midwest. Um, Full disclosure, I'm probably the least articulate and least qualified of the panelists here to talk about this subject. And with that in mind, you'll have to excuse if I look at my notes from time to time to remember all the things I want to say. With regard to obstacles, I would say, there have been a lot. It's been a difficult journey in the role I've had in sustainability in my department, but I'll give you a specific one. Um, we looked into the issue of shutting down PCs for energy saving in our department, and this process began several months ago. There were lots of unanswered emails that I sent out to people in our IT department about this, and several emails that basically said I'd reached the wrong person, or this couldn't be done, that sort of stuff. It's persistence that really sort of paid off for me. So eventually, a couple months later, I got to the right person, and that individual actually was open to discussing the issue with me, which was a start. But he expressed a bunch of sort of technical concerns that I didn't have great answers for. Among other things, he told me that he thought that shutting down the computers would actually consume more energy than letting them run idle for hours, which I didn't quite understand. And at that point, I guess, it was a bit discouraging, and I thought about kind of pivoting and doing something else. But I'd read a couple of articles by a fellow radiologist in Europe on the subject and decided to reach out via email and see if I could get anywhere. And the author of those articles actually was very gracious, and he replied to me with sort of step-by-step bullet point answers to my specific questions. So I was able to actually go back to my IT department armed with this information and revisit the issue. Um, I'd like to say that that led to the program being implemented. It has not yet because of other technical issues, but basically, at least I felt like I had made some progress, and the IT department is telling me that they will revisit this issue in the summer. So, it's small incremental steps, but I think being methodical about it and being persistent was the key for me, at least.
Drew, I'm going to jump to you, and I would
Okay.
really love if you would tell people why you have an unopened contrast recycling container sitting next to a pair of sneakers in your office.
Well, so my name is Drew Caplin. I'm a interventional radiologist and a residency program director at a academic medical center within a very large regional health system in the Northeast. And the biggest barriers I've encountered are either, I don't know if it's a combination of apathy, basically just not caring, or feeling helpless that we can't change, like Rachel said, or people throwing up roadblocks because they have their little fiefdoms and they don't want to change. And so the contrast recycling bin is, I heard about this program from GE, and it basically sounded like the Nespresso pod recycling program for contrast. They give you this jug and a self-addressed box, and and whatever contrast you don't use, you toss in there. When it's full, you ziplock it, you call them, they pick it up, and they recycle it because iodine is a non-renewable resource, and there's just a finite number of iodine. In contrast, is the literal lifeblood of radiology, and certainly interventional radiology. And I knew when I was in this meeting and people were talking about JACO, and then finally someone said, wait, we're going to use this in a pediatric department. What happens if a child drinks it? At that point, I knew that when we jumped from like logical to hysteria, that it was just not going to happen. And I save that contrast thing. I look at it all the time, and I'll live to fight another day. I can also tell you that we've been successful with the monitor program, and I can certainly tell you what we did in my health system. And it's part of the reason why I definitely take a different tact with my conversations around sustainability. I don't mention saving the earth, and I don't mention anything about emissions and green. I talk about quality, I talk about safety, I talk about eliminating waste, and I talk about saving money. And those are things that the administrators that I speak with, those things really resonate with them.
That's a really key point that we're going to come back to is that a lot of the success is that, well, sustainability and climate and all of those related words are such there's such hot points, and frankly they don't get to the heart of the real ROI from these programs. And I when I talk with people about how they're thinking about their programs or how they design kind of a communications campaign to talk about what they want to do and what they achieve, I often talk about it as a covert and an overt goal. Your covert is you want to introduce sustainability into the practice, into the health system that you're in. Your overt goal is cost savings, quality, waste, etc., because you can have both at one time. And frankly, you don't ever have to tell the covert goal outside of the team that you will work for. You all know that your talking points are that overt goal, and you can come back to that and you can make real headway on that. That's such an important distinction, and we'll get back to that. We will get to Reed next.
Yeah, hi, it's Reed Omary, and I'm a physician in the American South. We're all trying to share where we're from, and geographically, um, Holly led off with explaining the opportunity for us to think from a global perspective, what we might in the United States learn from Europe, what we might learn from Asia. We have people present today from Asia, and I think also from Europe. Um, uh, I would say in many ways when we talk about this topic, um, uh, the U.S. is to Europe as the American South is to the U.S. One way to think about that is like, why do you live in the American South? Like, why don't you why don't you live in a place where people really care, and you don't have to pull your hair out, or like me, have your hair turn gray. And so thinking about the brick wall is just recognizing um, that the language we use that's been brought up early, from the other panelists and from Holly here really matters. And so recognizing we Holly talked about covert and overt, and what I recognized uh, it the brick wall, if you will, of living in the American South. Actually, I just learned to reframe it and turn it from a brick wall to an open door, and recognize that I can help people who live in places that are much more receptive to sustainability, communicate uh, um, with a broader audience, with an audience who might not respond to the ideological baggage that is tied to words, and helping uh, like, if we're going to be successful, it's not through technology, it's through people. Like, we have to interact, collaborate, network, align people. And that's really hard right now in the United States. If we just simply took, like, how would you define success in the United States? It would vary from person to person, from party to party, from organization to organization. So recognizing who your audience is something that I had to realize for myself meant uh, the opportunity to collaborate perhaps outside of my medical center, outside of my home territory, and also to build networks within that, and to do it in a way, such as Holly mentioned, that is perhaps more covert, or speaking the language that Drew brought up. Uh, uh, you know, speak instead of speaking like a climate person, speak the language of a CFO.
And with that, I'd like to, Tarek, you've had some good success with a contrast recycling project that is now, I believe, across the satellite hospitals. Would you talk about how that kind of started and then snowballed into a system-wide approach?
Yeah, I'd be happy to. And before I forget, Drew, you and I can talk about this afterwards as well, if there's any help I can give you. It's been the GE contrast recycling has actually been our most visible success. Um, we started back in 2023 on a very small scale at our main academic hospital, just in our main inpatient CT pod and in our main IR suite. Um, my experience with the program was it was kind of plug and play. It seemed like, GE had everything sort of organized. And it was really, I think the success of our pilot project hinged more on finding the right individuals in the department to manage it, oversee it, and keep moving the ball forward. Um, like everybody, I'm sure on this call, we're all very busy. The sustainability stuff is not my primary job, so I can't really oversee these things in a very granular way. So what I was able to do was identify one of our CT technical coordinators and one of our IR technical coordinators who were very, very committed to this success of this program. And each of those individuals established and maintained contact with a point person at GE. They trained all of their technologists how to, use the program, how to deposit the contrast in the bins, et cetera. And really, it sort of just grew organically from there. So um, we now have, since 2023, it's grown to 20 different sites in our system. That's outpatient imaging centers and hospitals themselves. And I think I'm looking at the stats here. I think FY 24 and 25, we reprocessed about 174 liters of contrast. And that number's been going up incrementally every year. It's been so successful, in fact, that we've actually attracted attention from other departments. Cardiology now has started doing this in their cath labs. Some of the pain management clinics have started doing it. So it's one of those things that, because it's so visible, again, it's sort of is metastasized now to other departments in our hospital, which has been great.
That's really amazing. And what you hit on is that you really did rely on that partnership with GE to kind of get the job done. And the industry connection, I know a lot of people in the universe go around, holding their nose when they talk about working with industry. But also, Reed has had a really great experience in his partnerships because it really behooves industry to be leaders on this, and they are actively looking for people to partner, and they've often got the resources that we don't. So, seeing that as a partnership and not as kind of a foe. I know that Reed can talk about how he worked with Phillips to do an LCA, a life cycle assessment, which I'm pretty sure was the first kind of cradle to grave LCA for radiology. And if you are newer to the sustainability world, a life cycle assessment looks at the footprint from extraction to when it goes out of use and goes into kind of disrepair or trash or recycling, and looks at where those kind of carbon hot points are, and can give you a really strong takeaway about these are the low hanging things that we can work on, and these are the longer term. Reed, do you want to talk about that process?
Yeah, thank you, Holly, and just to echo what Holly said and build on top of Tarek. Um, we will never solve this. We will never make a meaningful difference if we try to do it alone. And whether that's working as in healthcare delivery, working with our industry partners, working with other medical societies, like we have to do this together. And that's in the United Nations Sustainable Development Goals. That's actually number 17, Partnership for the Goals. And what we did together with Phillips was blend their expertise in conducting a life cycle assessment, as Holly mentioned, looking at material extraction to building the scanners, to operating the scanners, to the grave, and seeing what the carbon costs of that would be, looking at the material costs, and then seeing how once we have all that information, what interventions could we take that would make the most meaningful difference, the most meaningful change. And I think about life cycle assessment as in many ways it's the randomized controlled trials of the sustainability space. Uh, you have to learn how to do them, and it takes some knowledge of where you source the information. Even if you knew how to do it, you have to make the connections within your own medical center to how to get that information. And what we found sometimes was really counterintuitive. For instance, ultrasound is always billed as it's the greenest of the imaging technologies, and yes, per scan. What was most interesting about ultrasound is it's the one that was most dependent on the consumables. Where's the linen come from? What happens to that? And so we then have targets that we can try and address, just like Tarek brought up with trying to recycle the contrast agent. So one real takeaway is try to partner. Our industry really wants to work together with health systems, because it ends up being win-win. Thank you.
Rachel, you're off mute. Do you want to go? And then Drew, I'd love to hear once you talk about how you've kind of pivoted to the quality and safety component.
Sure. I just wanted to highlight one of the things that Tarek said, a couple things. First of all, identifying a point person, someone who's going to take responsibility, whether a technologist or someone who's going to take on the project, and also education and training, really key piece. And around waste reduction, around contrast, and also materials, one of our colleagues in Europe, Dr. Sarah Sheard, Dr. Sarah Sheard did a project around waste rejection at a single hospital with 2 CT scanners, and was able to show a reduction of something like 20,000 pounds cost in a year, financial expenditure reduction, by instituting a waste management and contrast recycling program within their CT suite for 2 CT scanners. And one of the things, so showing success is another really important piece. And one of the things she highlighted in talking about that project was the importance of just putting up signs, reminding people of how to manage their waste. One of the costs, not just the contrast usage, but also the habit of taking all the tubing and everything and putting it all in the sharps bin, is actually quite energy intensive and costly, because really only the needles need to go in there, and that waste is incinerated. It's very energy intensive. So just instituting a training program, identifying a lead technologist who's going to take charge of this, putting up educational signs and reminders, teaching people how to do appropriate waste management, led to a significant financial expenditure reduction for them, as well as an energy expenditure reduction. So just wanted to highlight those kind of pieces of identifying a person who's going to take charge of a specific project, education and reminders, and also highlighting success at the end.
Just dovetailing on that comment, my first real failure was around recycling, and it's something that I didn't do a lot of education about. I just assumed that since recycling was just part of life, that it was part of life for everyone, which is a mistake. And so recycling bins showed up in the department, and it was basically a disaster, which then with my upcoming project really reframed my approach, like Rachel talked about, assembling a team of people from various professions within my division: nurses, techs, residents, medical students, other attendings, advanced practice practitioners, all who are interested in this and are all willing to divide and conquer and spread the word and educate and just making sure that my leadership had buy-in. I think all of these things will result in success in my upcoming sustainability projects, and definitely lessons learned, and plan to do a lot more upfront education, a lot of more upfront signage around that, and also using the tactic of we can do this and eliminate waste, save money, and not compromise the care of our patients. That this will not have, a negative impact on the excellent care we deliver, and the extra steps maybe that it takes are going to be worth it to achieve a larger goal.
Who wants to talk about, because you've all had interactions with the Green ID and kind of bringing that over from Europe to the US. Who wants to talk about what that is and what that could potentially, what kind of resource that could be?
Why don't I just start and then others can chime in. So, um, as background, I think we all want to share lessons learned, and we all want to try and improve quality. And in every part of healthcare, there's some way externally of trying to show quality. It might be the Joint Commission, it might be an accreditation for our scanners, et cetera. Um, the European Society of Radiology, under the leadership of doctors Andrea Rockel and Sarah Sheard, um, developed something called the Green ID program. And this was really the first program at a radiology society level to put some sort of standards in terms of what we might try and achieve with implementing a sustainability program. And Green ID was launched as a program from the European Society of Radiology, where departments could they could essentially go to their website. We'll be able to share the links. There's a checklist. Do you have do you have a so-called green team? Are there ways that you can show how they're recycling bins? What about operational protocols to monitor energy or power consumption? These are different ways. There's no one way. There's a collection, and so they launched this, and a number of European departments started to get certified through Green ID, and even now it's moved outside of Europe. And the American College of Radiology in the United States is in the process of working together with the European Society of Radiology to see that if we could pilot such a program in the U.S. So that's hasn't formally been launched yet. Things are looking pretty positive. I know the leadership for both organizations really wants to help make this happen, and we're way better off having a sort of a uniform name that's used across the world, yet flexible enough for each nation or department to try and tweak it for something that's relevant for them. Uh, Rachel and Drew, do you want to comment more?
Drew, did you want to?
Okay. So just a little background. I bill myself as a high functioning lazy person, meaning if I don't have to work hard, I'd rather work smarter. And so I was thinking about how to implement a sustainability program either locally or in my work with one of the societies I'm involved with, creating a toolkit for a sustainable practice. And I was looking around and I found the Green ID toolkit, and I was said to myself, well, why reinvent the wheel? Why potentially offend someone because something looks similar? And why not just reach out? And so, it started with Reed and I just having a sidebar conversation about, can we do this? And it was just finding the right people to ask a question, and they were excited. Um, and that being said, there's also maybe some skepticism of whether European sensibility can be applied to the United States. And granted, there's things in that toolkit that are just different in the U.S. So we'll look at that. And then there's things that, thinking about it, if I'm trying to that's going to be my Earth Day project, trying to apply that toolkit to my local interventional radiology department. And there are things that I just don't have control over that I'll never be able to accomplish in that toolkit. But the fact of the matter is just trying, seeing how it works, and trying to do like an iterative sort of PDSA, quality improvement project. Let's see what baby steps we can take. And if we're successful, then we'll take more baby steps. And maybe, we're not going to have amazing success the first year, but I think if I have a team that's committed to it over time, when we look back, we'll say, "Oh my God, I can't believe where we are, because where we started at was at zero." And I think that it'll be interesting, it'll be fun, and it will eliminate waste, save money, not sacrifice patient care, and also be good for the planet.
Yeah, and I'll just add that we're quite optimistic from the ACR perspective that this is going to get off the ground, and we'll have a pilot for people to participate in. And one of the things I think that's nice about the Green ID model is, again, it's a self-attestation, and it has kind of levels. You don't have to be able to do everything on all the lists. In a way, it's a way to just get you thinking about what you can do, what the possibilities are. And you get points for different things that you do. And the experience in the European Union or in the ECR community or ESR community is that people were so excited to do it that if they achieved the first level, they already started making plans. How can we get to the second level? And I think that gets back to the idea of recognition, right? People, you want to feel like you're making progress. And the only two required elements of the Green Idea program are to have a sustainability committee or point person, or sort of to label it as a goal, right? Someone is in charge of this, and to do some education, whether it's looking at some of the materials that they have or attending a webinar like this, or so I think those are the two sort of basic first steps, and I think it's nice that they highlight that. And we are fundamentally Pavlovian, right? So if just like on your Strava or your fitness watch, or if you get a gold star for hitting these points, then you're motivated to try and hit the next level. And I think it's nicely designed in that way, and it's informative. You learn a lot from even just looking through the checklists of what you might tackle next.
Tarek, you were off mute. Did you have something?
I just wanted to just echo some of that. I mean, I actually brought the Green ID thing to the attention of my chair and wasn't sure how it would be received. And to my surprise, he liked the idea quite a bit and was sort of encouraging. We haven't sort of checked all the boxes yet, but as Rachel just said, even if you don't think you're going to sort of get everything done, it's a nice sort of checklist to look at and to sort of say, okay, this is something we haven't even thought about. Can we do this? There's a lot of, or at least there are some items that I would consider sort of relatively low-hanging fruit. There's stuff in there, for example, about signage in the department and, We implemented some of that for our techs, for example, to encourage them to follow shutdown procedures at the end of the day, that kind of stuff. It was pretty easy to do some of that stuff. So it's just a nice jumping off point if you're looking for ideas.
You know, I'd like to start with you on this one, Tarek. If someone is watching this today and they want to take that first step this next week, and they're not sure if anyone in their department is thinking about it or interested, and after you answer that, this will go to everyone else. What can they do to get the ball rolling?
Um, well, I mean, one of the first things I did was I just kind of sent out an email blast. I tried to think of everybody I could, and I included everybody in the department. So attendings, residents, fellows, nurses, technologists. A lot of that was because of the fact that, at least in my experience, the techs and the nurses are often the people who are most sort of ardently, passionate about doing stuff with this and have really driven our stuff the most. So email those people. You're not going to, most people won't reply to you probably, but the ones that do, you can have a pretty good sense that they're going to really want to help out. And they could maybe turn into some of those point people that I, mentioned we use, for example, for our our contrast recycling program. So that's one thing I would do. The contrast recycling thing, if you haven't reached out to GE, go ahead and start a conversation with them and see if it's feasible where you are. And then something that I don't know, I can't remember if anybody mentioned it before. One of the things that I've done that has kind of helped me feel like I'm making some progress is I actually reached out to the medical school for the educational side of this. Um, Investigated whether or not they had any sustainability topics integrated into their curriculum. Again, that was a long process. It's been 2 or 3 years, but now that there's a seminar series on sustainability, of which I'm one of the speakers, and that wouldn't have happened, I don't think, if I hadn't reached out and sort of, said anything about it. There was interest at the medical school, but I think they were looking for people at the academic medical center to kind of be willing to champion this stuff. So now that's kind of grown into, we're actually starting our lecture series on sustainability for our residents in April and May. So yeah, just kind of reach out to people, start networking.
Read your next on my list here on my feed.
Yeah, so what I would do on Monday is I would take Holly's notion of the covert and the overt, and I would go covert. And this has nothing to do with the fact that both my parents worked for a certain agency that was located in Langley, Virginia. But I would actually there's no place in healthcare uh, right now which isn't concerned with saving money, protecting supply chains, conserving precious resources, and you could find whatever your niche is. If you're like a scientist and you're in a lab, like, oh my goodness, there's so much stuff. You can just change the temperature in the freezers from -70 to -60. That's like a no-brainer.
And it is also proven that it will not impact the items you're keeping in there. There's actual research on that we can send if you're concerned.
Yeah, and so like you could, if you're in a lab, you can just go into all the freezers and don't ask for permission. Just go do it. Just turn it to 60, and then people. Well, Holly's not, but you can really you can do this. And so if you're in radiology and you use contrast agent, specifically if you're doing a lot of CT scans and have a busy CT scanner, are using multi-use vials. That's a huge money saver, saves contrast, everything. So you don't need to bill it. as an environmental thing to begin with, you can actually view it as a resource and cost savings. That's what I would recommend on Monday. Just find something in your area and try to begin from a place that saves resources or money.
True.
Yeah, I think a lot of the resistance that I've had to this is fear, and not fear of change, but fear of a major accrediting body that hospitals care a lot about, and whether change and many of the rules that have been set by that accrediting organization are arbitrary and not evidence based and not fact based. They're just kind of observations and people make decisions. So there's a lot of fear around that, but what I recognize now is that they actually do have a sustainability program. And one way that I've been successful is our hospital now really wants that certification. And so they want ideas and they want projects. And now, suddenly, since that accreditation organization is paying attention, people have certainly become more receptive. And so, um, while I have tried covert with kind of not so much success, I think now that the things that people who give me permission to do things, like, now that goals are aligned, it's much easier. And I don't really care if it's sustainability goals are aligned. It's as long as I can find some common goal that's aligned that allows me to move forward. That's great for me, and I'll take that as a win. And it's just finding the point of common ground, whether it is money, whether it is waste, whether it's accreditation, whether it's quality, whether it's safety, just trying to figure out. It's like the book by Chris Voss, Never Split the Difference. And you're essentially trying to build rapport in such a way that people negotiate against themselves. And if you can figure out someone's motivation, you can use that to get where you want to go. And I find that book, whether it's dealing with my children or in the C-suite, like, really impactful.
Rachel, what about you?
Well, I just wanted to bring up a couple things. One along sort of tacks you can take. In my own practice in the Pacific Northwest, we have suffered from flooding events. We've suffered that have closed our hospitals, quenched our MR, shut down an imaging center. We have been impacted by intense wildfire smoke that has prevented people from coming to work, or that has flooded the ER with patients. And so I think there's the practice resilience aspect, right? In addition to financial savings, there's we need to be prepared. How are we going to protect our supply chains? How are we going to provide care if our main hospital center isn't functioning? How are we going to develop systems that address these potential events? So that's another motivating factor, I think, and I think those are interlinked. Similarly with contrast, there's the recycling aspect in the sustainability sense, but there's also recycling and decreasing how much we use because we're going to run out. It's not an infinite supply, and weather events can upend our supply chains, but also at our current rate of iodine usage, we're predicted to demand is going to exceed supply in the not too distant future, right? So I think there's a real operational angle to this as well that you can work. I wanted to highlight again industry partnerships. It's actually amazing how a lot of the big players in industry are working on refurbished. For example, at the European College of Radiology this year, they had, I think it was Philips had two ultrasound machines, and you could play with them and use them, and then you had to vote for which one was a refurbished model versus a new model, and you cannot tell the difference between the two. They have programs to have models that have automatic shutdown during idle time, automatic power save mode. You can even have a dashboard that shows you how much power you're saving, those kinds of things. So actually a lot of the industry, Siemens, Philips, GE, I'm not trying to highlight one company over the other. They really are thinking about these things. And so there's a lot of opportunity there. And the last thing I would just highlight again is education. The more you reach out to people, the more you start to do work in this area, the more you learn. The amount I have learned in the last few years working with the people like Reed and Tarek and Drew, and just interacting with the sustainability community, I've learned so much about all these aspects of the way we practice that we have influence over, and that could make a difference that I had no idea about. Like the habit of putting all the waste in the sharps just because it's easy, right? Like if you just take off the needle and put everything else in the regular waste, you can make a big difference. So education and collaborating with other people really opens opportunities, I think.
We are winding down, and you brought up something I wanted to make sure that we hit on. Get to know your supply chain teams and departments. They are having to think about resiliency at every step of the way. And there's a lot of innovative, interesting work that's going on in supply chain. And frankly, supply chain is how sustainability can really kind of come at scale. They can demand vendors talk about how sustainable their products are and start comparing plastic or packaging versus this or that. That's an undertapped ally that they would love to have conversations. So we are down to the last few, and I wanted to see if we have any questions from the audience. I've put a few resources into the chat. We will be sending across an email later today, perhaps first thing in the morning, with these. Thanking you. Please feel free to find us all on LinkedIn. We're very connected, and we would love to keep the conversation rolling however we can. But yeah, questions. You can chat, raise your hand, however you want to do that. And while we're waiting for questions, does anyone want to? Oh, here we go. Is anyone aware of opportunities to recycle, reuse,
Gadolinium.
Gadolinium.
That one. Thank you. Contrast agents in the U.S.
I'm not aware.
Me
Tarek,
neither.
Rachel, Drew.
I'm not aware either, no.
Me neither.
I don't know a specific program, but again, there are many things happening in the contrast space. And you can think about multi-use vials, right? So that you both have fewer vials themselves, but you also have less waste when you drop a dose. There's, instead of having multiple vials with residuals, multi-use injector, power injectors. Also important, there is work being done on new gadolinium agents that require less volume. And I know that a lot of the pharmaceutical companies are thinking about newer contrast agents. And there's actually some interesting work being done in the AI space, which is a whole other can of worms around energy usage, but around algorithms for virtual or augmented contrast enhancement that might lessen our reliance on actual IV contrast.
Has anyone addressed the use of disposable gloves in their institutions, similar to Gloves Off campaign in the UK several years ago?
Other than conversations with my partners who just talking about the number of gloves that you use during a case. And so frequently, for example, I was doing a procedure yesterday, a spine procedure, where I was using both CT and fluoroscopy and some post processing. So I was constantly walking in and out of the room and having to take off gowns and gloves to do that. And I kind of realized midway through what I was doing. And at that point, I just then rather than taking the control and being a control freak about it, just my tech knows what to do. And I just said, "Can you do this for me?" And he was able to do that. And I've talked about this with several of my colleagues. Like it feels like one of my colleagues used like 10 pairs of gloves during a case and just say, "Hey, do you think, is that really necessary?" So nothing really formal, but something that I just noticed, and I've been just gradually talking to my colleagues about that during cases. Do we need to really change gloves as many times as we do?
And I know this was mentioned by Dr. Hernandez here about better dispensing mechanisms. In the Netherlands at TU Delft and at Erasmus University, they have a human-centered design team that has looked at the use of gloves, and they found one of those very classic things when the box gets to a certain level, you pull, and if it's upside down, you pull it, and then like 10 gloves fall, the last 10 gloves fall on the ground. Like, how many times have we all experienced that? I know they're doing some work. JC Deal is the person who's been leading that.
Any ending thoughts, Tarek?
I would just tell people who are in this space, if you're getting started, don't get overwhelmed. I think one of the mistakes I made at the beginning was coming out of the gate a little too fast and had so many ideas, so many things I wanted to do, and that was a recipe for disappointment, I think. So pace yourself and sort of, take the small wins and sort of be happy with those, and you'll make incremental progress that way, I think.
Well, we are exactly on time. So with that, we'll wrap up. If you have any questions, I've put my email in the chat. I can forward them to any of the panelists. And also, we'll be sending around that email later today with recording link and feedback and some resources that were mentioned here. So thank you so much. Find us on LinkedIn at Greenwell Project, and we hope to work with all of you soon.
Thank you.
Thanks, everyone.
Yeah.
Thank you.